So first I want to recognize the team that we have. The advocacy team has done a great job this year. Doctors Nakano, my co-chair, Dr. Garcia, Garvin, Mendoza, Minnie, Park, Roki, and Thaker. All these people put in a lot of time. Although this year during the pandemic, we weren't able to be in Sacramento, we were able to speak with Sacramento. And as you can see in the next slide, we actually had a lot of tremendous wins this year, despite the pandemic. COA reached out to the Immunization Guideline Committee members early to advocate for optometry to be classified as Phase 1A. They had not even considered optometrists or how they were even going to reach non-MD independent practitioners. COA helped the counties get notices out to optometrists so they could be vaccinated as soon as possible. Most of optometrists have at least got their first shot. And if you're having problem getting a vaccine, please let us know. We've been successful in getting individual members vaccinated. Online live CE, COA worked with a coalition to push to temporarily waive CE requirements. And we got our own board to allow online CE to count as in-person if it is live and interactive. Just last week, we obtained a waiver to allow optometrists to administer COVID-19 vaccines. In California, we believe optometrists are primary care providers and that they have an important role in improving public health. This is going to be an opportunity to force the integration of optometry into the healthcare system. This is one change that we can really impact how the public views optometry. And I really beg all of you to get trained and begin to volunteer in your communities giving the COVID-19 vaccine. Adult eyeglasses coverage, we fought back a proposal to eliminate eyeglasses coverage from the Medi-Cal program because of the expected budget impact from the pandemic. We held our virtual legislative day, and as a result, the legislature voted to against the governor's proposed cut. Telehealth payment parity, we got an early enactment of the law that requires telehealth visits to pay the same rate as in-person visits. And we also got the author to draft a letter to the Journal to make clear that the law would not require payment for online vision testing. The Attorney General's approval of practice sales, we got optometry exempted from a bill that would have required the Attorney General to approve certain types of practice sales. Mobile clinics, COA helped draft and was very involved in passing legislation to allow charitable mobile clinics to continue to operate. And we also made sure the law could not be used by for-profit entities. And PPE stockpile requirement was defeated. COA helped kill legislation that would require all optometrists to maintain a stockpile of specific types of PPE for employees and or face fines. And then we've had a new advocacy win just this week. COA has been working with a coalition, including the CMA and the Restaurant Association, to get additional financial help for small business owners, including the deductibility of PPP loans and small business grants. And the governor announced a deal on these issues this week. So what are our goals for 2021? COA is extremely concerned that students are forced to travel to take their national board tests during the COVID pandemic. The advocacy team has been seeking a solution that will protect students from risking their health and their lives. Early in the pandemic, COA has worked with colleges to request an official waiver of the NBO requirement from the Newsom administration. It was ultimately denied. When we pressed the state board to allow the colleges to attest to a student's competency or force the NBO to offer a test at the California schools like it used to do prior to 2013, while the board members were sympathetic, they had no power to force the NBA to do anything. And the state board could not act without the determination by an outside agency that what the colleges tested is the same as the NBO did, and that would take too long. Plus, there are no guarantees of success. So COA, along with many others, lobbied the NBO to make some accommodations for our students, but they were intransigent. After we exhausted all of our administrative solutions, we decided to introduce legislation. After talking to the legislative staffers and others, it was decided that there was too much opposition to allow student graduates to temporarily practice without taking the NBO. Some other states had created provisional licenses that allowed graduate optometrists to practice under supervision of another optometrist, so at least they can pay their student loans. And after much debate and discussion, we decided that this was probably the best approach. I'd like to personally thank the colleges for all the help they did in getting to this point. All 3 college deans or presidents have been tireless advocates for their students, and we could not have come this far without their support. But our fight, unfortunately, has just begun. We need everyone to go to the COA webpage and under the Governmental Affairs tab, select your legislator and send a note to your lawmaker in support of our legislation. The next issue that COA is going to battle is illegal contact lens sales. COA and AOA have been fighting this battle for many years now, and we've had some wins against individual companies that have led to some pretty big fines, but it's like a whack-a-mole out there. One company goes out of business and another one comes into the market, but just because it's hard doesn't mean it's not worth doing. We need to stand up and try to enforce the laws on the books. To do this, we need examples of brand substitution, examples of sales without valid prescription. Complaints need to go to the state board and the FTC. And in the chat is instructions how to file a complaint, and we need you to do this in order for regulators to take action. Next is scope of practice expansion, and we were pleased that the governor's administration approved optometrists being allowed to administer vaccines. This authority will last only as long as the emergency executive order is in place. So we have introduced a bill in the Assembly by member Ed Chow, representing the Western San Gabriel Valley, called AB 691, to allow optometrists to provide vaccines permanently and to test for COVID in their office. We have also introduced AB 407 by member Salas and Lowe as a vehicle allowing us to continue our discussions about additional scope of practice increases with ophthalmology. The current version of the bill allows optometrists to treat blepharotosis. The plan is to add more authority to the bill as negotiations continue. The big hang up with negotiations is that ophthalmology always wants to allow their medical assistants to perform subjective refractions on patients. They don't want them to be able to write prescriptions, just perform the testing. And we said we would consider that if ophthalmology would remove their objection to allow optometrists to perform advanced procedures. But there are other things we want in a scope bill that are also on the negotiation table. Many new drugs are coming on the market for conditions that optometrists currently do not have authority to treat. Remember, our law has historically been written very specifically and lists the conditions and not the drugs allowed. As such, the ability to treat myopia and presbyopia with medication is still unclear, and we need more flexibility in the statute. 3 years ago, we were successfully negotiated language to allow new medications, technology, and medical devices, but they had to be for a condition that optometrists were authorized to treat in statute. At the time, this was a huge win since it was the first time we were allowed new things that have not yet been invented, but we need to press further and allow new conditions as medication is developed. Injections are also going to be important for the future of our profession. Soon the standard for care for treating glaucoma may be an injection, and we may need to be able to provide our members with the best treatment options on the market. Scope of practice expansion can be frustratingly slow, as you know. Progress is always incremental, but together in time we will succeed. And last, Medi-Cal also remains important to us for this year. 1/3 of California's population is on Medi-Cal, and that number seems to be growing. We need to increase reimbursement rates to keep up with inflation. We are also working to address the long wait times for Medi-Cal lenses that come from counties that are facing backlogs because of the Prison Industry Authority COVID cases. Some patients are having to wait up to 4 months to get their glasses, and that's not acceptable. And we're seeking to use the crisis as an opportunity to allow doctors to use their own labs. Dr. Nakano.
Thank you, Dr. Redmond. And I too want to echo Dr. Redmond's thank you to the committee, and definitely a great partner in Dr. Dave Redmond. He's been doing this for a number of years, and I believe we've been pretty successful this past year. I'm going to touch on optometry and the vaccine. So as you know, California has 40 million people that need to be vaccinated. And now that President Biden has initiated the Defense Production Act and purchased more vaccine, We will soon begin to receive more vaccine, and we, optometry, need to be ready. We don't know exactly when the vaccinations will be available to the general public. Most people think it would be summer, fall, but we could be wrong with that. We can't just think about how things are today. Later this year, there will be millions of people that need to be vaccinated, and optometry, again, needs to be ready. Vaccination or vaccine administration is a great opportunity for optometry to move forward and remove more barriers between us and medicine. We hope that you would consider getting trained and certified to provide this vaccine. And I'm not just saying this to say it. I personally have fulfilled all three requirements. And the requirements are, as you can see, there are three of these training requirements. The 20-hour course includes 12 hours of self-study and 8 hours of live seminar to learn how to offer vaccines and demonstrate injection technique. Some places allow you to do the live requirement via Zoom right now because of COVID. Some places require you to come in person to demonstrate injection technique. You also need to pass an online test. And it's not insurmountable. Even those that have been out for a while, I took it. I'm old, I did it. So to let you know, the availability, Ketchum University has scheduled a course starting on March 21st. Western University also is planning a course in March. You can also take the course from one of the pharmacy associations. The second requirement is having to be certified in basic life support or CPR. The third requirement is a free short self-study program from the Department of Public Health on COVID vaccine. Previously, it was about a 3-hour course, but now it's down to about an hour. And honestly, I think I probably did it myself in about an hour. Everyone says it's really rewarding to volunteer. People are very thankful for saving their lives. There will be more opportunity to volunteer soon. We need to prepare now for when there's more vaccine available and the storage issues get easier. So vaccine procedures requirements. So once you complete your training, you need to register for the reporting website so you are included in the system. To give vaccine, you must complete all federal and state record keeping requirements. This includes providing documentation to the patient's primary care provider and entering information in the appropriate immunization information system. Storage issues. Moderna thawed vials can be refrigerated for up to 30 days prior to first use, so you do not need a big freezer system to offer vaccine in your office. So who can you vaccinate? It's 16 years or older for Pfizer, 18 years or older for Moderna. Patients must be monitored for 15 minutes post-injection. The wait time when people get dilated might be a perfect time to get vaccinated. So if you're looking at workflows in your practice, that might be something that you can add. So billing questions have not been addressed yet. The federal government is paying for the vaccine, but there's a fee to administer the vaccine that can be charged to insurance. We're reaching out to health plans, asking them to set up systems that allow optometrists to be reimbursed for administering COVID-19 vaccine. Liability issues. As long as the vaccine is given in accordance with the waiver, it will be within the scope and covered by COA insurance programs. Federal and state law provide immunity from lawsuits as long as you follow the rules and practice within the standard of care. How to encourage patients to get the vaccine when they're in your office. Let them know it's common to have a reaction. 80% of people will have local reaction, including swelling or redness at the injection site. Vaccination is an important conversation to have regardless if you plan to administer the vaccine yourself or you're referring it out. Sharing that you got vaccinated and why can definitely help. Many people, not just in California, but throughout the nation, are under misinformation. They think they can get the disease because of the vaccination, and that's not true. Educate them that there is no part of the disease in the vaccine. Let them know that the side effects are much more rare and short-lived and much more treatable than COVID-19 symptoms. The vaccines were not rushed. They were a product of international coordination, and they have been independently verified they are safe. The CDC website has some good information to give patients. Stress to the patients, they are still going to have to remain vigilant, wear a mask, social distance, avoid groups, and definitely wash your hands. So for more information, watch the AOA video on vaccines. Anyone have questions?
Thanks, Dr. Nakano. Any questions, anybody?
I think there was a handful of questions that popped up on the chat line. I don't know if you gentlemen have a chance to see that.
How many other states allow optometrists to vaccinate?
Not many.
Sure. I think there's only a couple other ones, actually.
Yeah, we're leaders in that in the nation.
Yeah, we are. One other question, how long does the certification last? The board has, I believe, if you pass a course, there's retroactive certification.
Dr. Dallas asked if we're advocating to make virtual CE count as live, and yes, we are. We're working with the state board on that already. Any other questions? Did we miss
Raj, I think we have 2 hands up.
Yes, we do. We actually have 3. I believe Annie Lee Kim, Will Toe, and Amanda Heidi Miller, pardon me. I'm trying to remember off the top of my head. Let's start with Annie Lee.
I just had a quick question. So to confirm this vaccination, I guess this is just for COVID, or is it from now on, if you do the training, we would be able to vaccinate for anything? Like, is this just a temporary thing just to get people vaccinated?
Right now it's temporary until we pass it on COVID for sure. But they're limited in our vaccinations, limited to the flu, herpes zoster, it'll be COVID and pneumonia.
Okay.
The course is the same regardless of the vaccines we can give.
Got it. Thank you.
So just to let you know, the course actually covers, it's the same course the pharmacists take, and it covers literally just about every vaccine that can be given. The course isn't restricted to the 3 that have been passed by legislation. And then you learn different techniques, the subcutaneous injection as well as the intramuscular. And you actually, if you have the ability to actually attend one, you will actually inject saline into a fellow OD's arm. So you actually learn a lot about other medications and a lot of the side effects, contraindications, things like that. So it's really a good course to become very knowledgeable about different immunizations. And one of the questions was, if they pass MBEO injections, no, that you have to still take the APHA course.
So I'm sorry, Mark, Dave, maybe you guys can just reiterate. I might have missed it, but how do ODs get paid for giving this vaccine? Obviously, they're not going to give us the vaccine for free. I know the federal government is covering some of the costs, but how will we get paid for providing this to our patients?
The actual vaccine itself is free. The administration of the vaccine is what you can get reimbursed. And actually, COA staff is working with insurance companies and trying to resolve that part. So that'd be basically a CPT code.
Excellent. We got a couple other hands raised. I believe next in line was Will Toe. Will, you unmute yourself, please.
Thank you. Just on the topic of the vaccine, but also backtracking a little bit in terms of when Dave was talking about legislation to help the new grad optometrists that would be unlicensed and would have difficulty obtaining their licenses because of COVID. With the direction that everything's heading right now, obviously we don't know if COVID's going to take a huge downturn, but it seems like we're kind of heading out of it now with the distribution of the vaccine and access of the vaccine to all optometrists. Is this type of legislation even necessary anymore? Only because, like I said, we seem to be on our way out. Obviously, if you know, they're having difficulty traveling to North Carolina to take their boards and whatnot, you know, we want to be able to do something for some of these new grad ODs who want to practice in California. But like I said, is there another, I guess, an easier way to do this rather than trying to force through some kind of legislation and instead work with MBEO now that, you know, and having potentially help them with policy regarding candidates who need to take boards, you know, or being, you know, if they're vaccinated, that there wouldn't be any type of restrictions?
I think Will, that's a good question. One of the issues is that it's in our statute that students need to pass the NBEO, right? So, and that's the only single way that a person can become licensed in California. And so what happens during the next pandemic or the next, you know, natural disaster or whatever, we're going to have to resolve that issue for the future. So I think legislatively we probably still need a fix.
Okay, I got you. So it's not just this specific COVID pandemic. This is to help protect it and guess any other future ones. So you want to have formal legislation.
Absolutely.
Gotcha. Okay, thank you.
Did you have another part to that, Will?
No, that's good. Thanks.
All right, I believe we had a couple other hands up. Next on my list, and I apologize if I skipped anybody, is Casey Nakajima from Monterey Bay.
Hi there. Sort of a newcomer here, so forgive me if I am a little redundant. I know that it was mentioned that it's the APHA course that we need to take. Is that the only course that we can take? Or I know through Pacific University College of Optometry, they've also had other injectables course, and as a student, we also did that course over there. Does that have any crossover, or for California, does it have to be the APHA course for the injections?
I believe it's in the statute. That's why we have to follow the guidelines in the court.
So for that one specifically, so nothing, there's no crossover from the injections courses or training that we physically did in school.
It has to be an approved course by APHA. Yeah.
Okay. That answers my question. Thank you.